Which hey Tvghana, so buy a channel not for the first episode like now share your stories and we are subscribing and leave comments or comment section or as in Kamia Kwako yes Honorable Minta Akandoh Health Minister Bishna Raf Hon Great Hospital Hon no it then can we anytime soon abusha enra akako grant interview be abusha ne some of the akako got TV3 hot issues na so no na medini nyina ebro hana abusha wa kire nsemu Kwanya Ralph Williams isibaha ne hobetre ono so ne style of stories any day hospital no so air can the association no air can abusian the bottom line in all of this no just say ne tintini ne titi mu nyina the minister ipeso o katre ne say asa ne de Ralph aba betre the story mu actually or no personally that or him kamia kwa say nurses and midwifery association and sema me hospital and sema all kano and the Ralph Williams so kano there is a very big difference pa a woman Ralph ne de trima on there wanye boni bia on an bia anya boni bia but acquires a hospital no person use these issues you know na omode ekeka kan sem bi make the government unpopular into sem na ni the Ralph kind of some particular point in the interview, you know. Minister somehow can say, oh, say pay we a patient now corner say depending on how urgent your situation is, and I say, and you may be do baby na say abufobi koba bi akasa bi ekobemu ha yara etada ntia se kakra wom sana minister eka because or say looking at how ani pankwan hia na etoda situation be emotions no timi clado yema hate be ye niema but Ralph abetre means no hu say Ralph was not so wrong after all but because say some no dia quite crazy say you which side the health minister was because on one kasa no ochima nsem na Ralph catch ne the hospital ne kana say on shede nhuso ni nchiribu bibri na ne enye bre na wan kasa kuti nsem ni bi we are no watch our comment section as
This is Joboso MP and Minister for Health, Kwabena Minta Akandoh. Again, thank you so much for talking to us.
And the farmer.
A lot of times what we get from trained nurses, trained health workers have not been posted. Some as far back as 2020, 2021, 2022. What is the state of employment now in that sector?
Good. So let's understand what exists in the health sector. Now, the previous administration took off office in 2017 and permit me to go in that direction a bit. They criticize us heavily for leaving backlog, not even more than 2 years backlog. We were criticized heavily. Now, when they took office in 2017, their first time of recruitment was done in 2020. Hear me well. In their first 4 years, they did only one recruitment in the health sector, nurses, in 2020, major. Okay. That was even in December 2020 before the election. And they began their service in 2021. Now, after 2021, they never did any recruitment again until 2024. Can you get a coincidence? 2020, 2024.
Election years.
And then when they started the 2024 one, they never recruited. They left it onto us. And so now, as I speak to you now, this government is supposed to pay not less than 13,000 nurses, which they began the processes in 2024. So properly speaking, they did only one recruitment in the entire 8 years. Do you understand the trajectory?
Right.
Only once. And so we have the 2021 batch is what we came to meet in 2025. And that is the batch we are recruiting, and we have recruited, and we are looking for money for them. And out of the 13,000, about 10,000 have been captured on the payroll. Out of the 10,000, about 7,000 have been paid, and about 3,000 are yet to be paid. Okay? So we have the 2021 people at home. We have the 2022 at home, 2023 at home, 2024 at home. So in all, allied, pharmacists, physician assistant, nurses, if you put all of them together, we have not less than 70,000 health professionals that have been trained and are at home unemployed.
70,000?
You heard me right. This is what we have inherited. If we had added that 13,000, we would have jumped to 80,000 and over. If that sack people who were employed after 7 December, okay, happened in the health sector, by now we would have been talking about 80-something thousand people we inherited.
Because 13,000 people
would have added. And so these 70,000 people, there must be a clear strategy to deal with them.
Do you have one of?
That is what I'm going to talk about. We don't lament.
Okay.
We fix problems. So we have, I'm talking about pharmacists and everybody in there, I've put them together. So the strategy is that as for the medical doctors, we recruit them every year. The last batch, we have done the recruitment, we are yet to post them. Now, this is what we're going to do. Government is looking at employing some of them almost every year to reduce the numbers. But the truth must be told that government cannot absorb all the 70,000 health workers within 1 year. So the truth is that even after 2026, there will still be some backlog.
Right.
You understand? So government is going to look at absorbing some of them, and then we are looking at how we can manage migration, export some of them to other countries.
Right.
And so for now, about 13 countries have responded. We are signing MOUs with them. They are looking at how they can get our nurses in their countries. Bahamas have written. Some very interesting countries have also written to us to get our health professionals. There's a problem that we need to fix, and we are fixing. What we have realized is that as part of the requests that come, we realize that most of the countries, they need the specialist nurses. And we don't have many in this country. And so we need to think outside the box to fix that problem.
To have
specialists to
right.
increase the number.
Right.
Out of those who have completed 70,000, so out of the 70,000, we have about 48,000 nurses. So what we are doing is that we are bringing out a program, the post-basic specialist program. Out of that, we are inviting some of the heads of the institutions, including the rector for the Ghana College of Nursing and Midwifery and all that. Everybody must come on board. How can we train, develop a curricula, a program to train these nurses within a short time for them to be specialists?
So help me understand your plan. How many are you hoping to retain here, and how many are you hoping to send abroad? So
now, what we are intending to send abroad will depend on the requests that come. Okay? If you want to send about, let's say, 20,000 abroad, and we have 10,000 requests, we can only send 10,000. Okay? And we'll also be very careful where we'll also not turn the coin, where we end up having less than what we need in the country. But of course, we are still producing more. And again, with this specialist thing, what we are doing is that those we are going to admit, we are looking at turning about 40 of the nursing training institutions into a degree, pursuing degree programs, nursing training institutions, so that we can increase what the demand on the global market is.
Yes.
So now back to my answer. We are developing a program. Instead of, let's say, 1 year or 2 years program, we're looking at how we can bring the number of years down to, let's say, a year or even 6 months. And we are at the table discussing that to solve that problem, to increase the specialists, that will be attractive to what the global market is demanding.
Right, but that's not something that could happen overnight.
No,
because you need to go through the loops.
No, we are at the discussion stages, and it's something we want to implement. I mean, latest by the end of this year.
By the end of this year.
Yes. We are very far, and we are looking at how we can use Kolebu and Konfanoche to come on board to solve a problem. Once we solve the problem, we may cancel that program.
I see. Now, I'll come back to this issue because I want to know what specialties you are hoping to train the nurses in post-basic nursing education, right? But when you look at the 70,000 number, how many are you able to employ this year in Ghana?
Again, you are putting me on the spot, and I do not want to give figures.
Okay.
Because for now, the 2026 budget has not been prepared. We've not even started the consultations on them. But very soon, because this year, you know, every budget in the past, except the election years, are being read October, November. You remember? Yes, so before it comes out, those figures will be there. And this time around, what we have agreed with the Ministry of Finance is that they are not to tell us which batch or which category of health professionals to recruit. Over the years, they will say, we are recruiting 10,000 nurses. But there are other categories of health professionals at home. We have the pharmacists, we have the allied. So what we have done is that, okay, if the budget can take 10,000, we'll then share it across, looking at the numbers. Of course, the nurses are always in the majority, and they will always have the higher percentage. But that would mean that we would have touched on pharmacists, we would have touched on allied, we would have touched on medical doctors, we would have touched on all the professions.
So as for 2025, no postings, no clearance.
Oh, 2025 is what I'm saying, that we have taken about 13,000 on our budget. And this is really where we're struggling to pay all of them.
But those people were employed in 2024.
Did they pay them? Did they put them on the payroll?
I understand the dynamics of what you're saying.
So it means
but
that
I'm saying
that number will not allow us to put more on the 2025 because we need space to pay them. And as I speak to you now, I've told you that about 3,000 to 6,000 of them have not been paid. So you cannot go and add more. I mean, what you have even recruited, you have not been able to pay all. You understand? And so the weekends, we heard about some kind of confrontation at the Ridge Hospital. So on Monday morning, I started getting the signals from the public. So I sent a delegation to Ridge Hospital to ascertain the situation. So when the delegation came back to the ministry and they were debriefing me, the feedback was that the health professionals were insecure. They felt they were panicking. And therefore, the recommendation was that, and of course, the Ministry of Health is very close to the Ridge Hospital. Yeah. So if I can go there and give them some kind of reassurance, so I did. So when I got to the premises, I had the opportunity to visit the victims. And after that, we had a closed-door meeting to look at the issues, discuss them, and see the way forward. So some of the issues that came up were the internal security of the place, how we can also link up with the police to take care of the security of the place, the staffing issues, and what have you. So it required that I had to constitute a committee to look at the issues. So I constituted a committee of about 5 people, a medical doctor, a nurse, HR person, an auditor, and a legal person.
So let me understand this. The committee you set up was not only to investigate the incident that took place, but the general safety and security of the place.
Whatever led to that particular event.
Okay.
Do you understand now? Good. So then, after that, I pulled out of the wards and then granted an interview to the press, condemning the incident outrightly. And of course, let me use this opportunity to reiterate that irrespective of the provocation at any health facility, nobody, absolutely nobody, has a right to physically attack any health professional in this country. It's not a matter of persuasion. That must be made clear. So that's exactly what I did on camera. Then I saw a gentleman pulled out in a black saloon car. Actually, he didn't park well, so I was even telling them to tell him to park well. And then my officers, my directors around me told me, they drew my attention, that is a said RAF. Well, I'm not a social media person. I'm not so active on the social media. So then he was walking towards us. So I began asking, gentlemen, why did you do this? In his attempt to answer the question, he was walking towards us and stretching the arm, willing to whisper something into my ears. Can you tell me, should I push him? Should I shout him down? You see, let's face it. I'm a minister responsible for health, for all health professionals. But then, I'm also a minister responsible for health for all Ghanaians. And at the time I met them behind the scene, closed door meet, I told them that, look, this is one side of the story. And so I need to listen to the other side of the story as well. And so the gentleman whispered into my ears that, and this is what he said. I'm going to tell you, I'm going to review what he said to me. He said, Mr. Minister, I won't explain here. I will come to your office and tell you my side of the story. That's what he said to me. I said, okay. Then I started, then I'm going to the office, so please come. And indeed, he followed up.
Okay.
There has been this misconception why he even pulled out at the same time I was there. Later, I found out that he was actually coming to the ministry to report the incident to me. And they told him I had gone to the hospital.
And that's why he followed up?
That's why he followed up.
I see.
So my cry is, why didn't I push him when he stretched his hand to shake me? Look, and I've made this point, and I'll make it again. As a minister, it is not in my nature, okay, to be disrespectful or to be rude to any citizen in this country, irrespective of where you find yourself, even if he has been sentenced to death. Okay? But don't forget, the issue has two legs. What falls within the jurisdiction of the ministry and the criminal aspect of the issue.
I see. And so then let's take it back a few steps, right? When you talked about someone being attacked, I want to understand, for a lot of people, there hasn't been any visual evidence to the effect that someone was attacked. As at the time.
Right. So that was the allegation.
What is, as far as you're concerned, what is the nature of attack that was reported to you?
That the nurse was physically attacked, like was brutalized. He was hit left, right, center, to the extent that she had a dislocation of the shoulder.
Wow.
As at the time I went, and I visited her, and she was in a bandage. So I visited and I instructed that, he said she had lost 800 Ghana cedis and their phone, and so I instructed that she must be treated free of charge. Her 800 Ghana cedis must be given to her, and her phone must also be replaced. Okay?
Who did she say attacked her?
Well, at the time, because I was not ready to go to the merits and the demerits of the matter, I didn't ask those follow-ups. I thought that would come up at the committee level.
Committee level.
You understand? So, in fact, my presence there was to reassure them, for them to continue to work, and not because the signals I was speaking was that they were considering other options. So just to go there and then encourage them. And indeed, I must be very honest, they were exceedingly happy when I got there. Especially the medical superintendent and the senior officers, they were exceedingly happy that the minister himself could walk there at that point in time.
Because of the incident.
Because of the incidents. So they were exceedingly happy. Okay, but Kemeni, let me make this point. In my ministry, I have more than 80 unions. Unions are good. They help us to run the sector. In as much as any union leader will demonstrate to his or her union members that indeed he's working, it is also important to note that it is a responsibility of union members to collaborate with government to find solutions of the problems to the union members. The union leaders may not have solutions to the problems of the union members. So it is always government. Government is always at the center of the issue. So it is a matter of collaboration. It's not a matter of opposition. There are clear differences.
Right. I agree. Now, let's deal with the criminal matter, because I recall that you said some arrests.
I don't have the capacity to deal with the
criminal
criminal
matter. But I recall you mentioned that some arrests had been
Yes,
made.
arrests has been made.
Who has been arrested in this?
Well, I don't know. I can't mention names.
Okay.
But I'm informed. I get briefing almost every day. I'm informed that some arrests have been made. Okay. And then the committee is also still sitting. I've given them 1 week to make their findings and reports.
The reason I ask who has been arrested is because the gentleman who is said to be at the center of this issue, we know is a free man. And we are unclear also at this time who physically attacked the said nurse. And so it's only fair for the Ghanaian people to understand when Minister says some arrests have been made. Who has been arrested? How many people have been arrested?
Well, my briefings indicates that some arrests have been made. I mean, statements have been taken.
Right.
Medical forms have been issued, and the processes are ongoing. But as to the details, I'm unable to give
You will not
details.
have at that time.
I'm unable to
And so your committee, what work have they done so far?
Oh, they are sitting throughout. They have only 1 week, so they are still sitting, and I'm very sure that they will hit to the deadline.
Again, I want to understand your thought process for wanting to set up a committee.
Yeah.
Because within the health sector itself, there would have been a reporting procedure for a situation like this. For instance, the nurse in question should report to her supervisor. Her supervisor then would institute an investigation. But you decided...
Everything ends at the minister responsible for health. Whatever happens down there ends at the minister responsible for health. So if there's any issue that the minister comes in, it's been escalated to the ministerial level. Do you get it?
Okay.
At the time I was going, as part of my entourage, the Director General, the people at the Ghana Health Service were all part of. So when the minister gives direction, it's a ministerial direction.
Right. Now, when you look at the incident itself that took place, there are two things that have happened.
Good.
A nurse who has been physically attacked, but also the incident that there was delay in attending to...
Exactly. So these are the issues. So there has been an alleged assault. I'm using my words carefully here.
Absolutely.
Good. So there has been alleged assault, and then there has been allegation of delay in attending to patients.
Patients.
Okay? The nurses or the medical